If I told you that walking every day might not be enough, and that this very habit could be quietly causing your legs to grow weaker after 60, would you be willing to keep listening? You're a senior. You care about your health. You've tried hard. You walk regularly, you elevate your legs, you wear compression socks. And then one afternoon, you notice something unsettling. Cold feet, swollen ankles, legs that feel heavy like lead. And when you stand up, you have to pause for a few seconds just to keep your balance. It's a moment very few people talk about, but almost everyone over 60 has experienced. And here's what truly startles many people. Poor leg circulation after 60 isn't just uncomfortable. It's an early warning signal for falls, for losing confidence while walking, and for the gradual loss of independence. You may walk very well, but if blood isn't returning to the heart with enough force, your legs won't be able to protect you when you slip, turn suddenly, or misstep. Today, I'm not talking about many exercises. I'm talking about do this one exercise, a short, safe movement, and exercises for seniors you can do right at home. It's one movement that a surgeon reveals has been used for many years to help older adults warm their legs, reduce swelling, and stand more steadily. If you're over 60 and still want to walk with confidence in the years ahead, don't look away. What you're about to see is very simple, and because of that, it's often overlooked. Precisely because this movement is so simple, many people don't realize that it targets the root cause of circulation problems after 60. The medical truth is this: poor circulation in the legs is not because you walk too little, but because blood is not being pushed back to the heart with enough force. After age 60, blood vessel walls lose elasticity, venous valves gradually weaken, and blood begins to pool in the lower legs and feet. Walking helps strengthen the heart, but it does not create enough sustained muscle contraction to push blood upward against gravity. In medicine, there is a very important concept called the venous muscle pump, located primarily in the calf muscles, often referred to as the second heart. When this muscle contracts slowly, with a hold and with control, it creates direct pressure on the deep veins, forcing blood to return to the heart. The problem is this: most older adults no longer activate this pump during daily activities, and that is why swelling, cold feet, and heavy legs persist, even though you are still technically being active. And it is precisely at this blind spot, where movement is still happening but circulation does not improve, that surgeons see the consequences most clearly. Orthopedic and rehabilitation surgeons do not rely on theory alone. They witness the outcomes every single day. Persistent leg swelling turns into skin ulcers, loss of sensation in the feet leads to stumbling, and then just one small fall can trigger a rapid cascade of decline after age 60. That is why in post-surgical rehabilitation protocols for vascular procedures, knee joints, or hip replacements, doctors never begin with "walk more." What is prescribed first are simple but controlled movements, specifically designed to actively activate the calf muscle pump. This is not an internet tip. This is a clinical principle used to prevent blood clots, restore circulation, and protect independent mobility. And when patients perform it correctly, the result is not just lighter legs, it is confidence returning with every step. Because of what orthopedic surgeons witness every day in the operating room and during rehabilitation, the core solution turns out to be so simple that many people find it hard to believe it can make such a profound difference. That single exercise is heel raises with hold, activating the second heart in the calves. It sounds almost too simple, but this is precisely the movement most trusted by surgeons and rehabilitation specialists to improve leg circulation after age 60. The reason lies in very clear physiology. The calf muscles do more than help you walk. They function as a pressure pump.
Each time these muscles contract and are held long enough, they compress the deep veins in the lower leg and force blood back toward the heart, working against gravity. Regular walking does not create enough contraction time. Heel raises with a hold do. How to perform it correctly: slow, safe, and effective. Stand behind a chair or next to a kitchen counter, resting your hands lightly for balance. Place your feet hip-width apart, with both feet firmly on the floor. Slowly rise up onto the balls of your feet, lifting your heels as high as is comfortable. Hold this position for 3 to 5 seconds. Breathe normally. Look straight ahead. Then lower your heels very slowly over 3 seconds. That counts as one complete repetition. Recommended dosage for adults over 60. Start with 8 to 10 repetitions, 1 to 2 sets per day. Can be done while cooking, watching TV, or in the morning after waking up. The most important factor is not the number of repetitions, but the hold at the top. That exact moment is what forces the pump to truly activate. When done correctly, many people notice warmer feet, noticeably reduced swelling, a lighter feeling in the legs within just a few days, and most importantly, e.g., the body begins to protect itself again. When the second heart in the calves has been reactivated, we only need 2 small additional pieces to help circulation and balance work more completely. Support exercise 1. Seated ankle pumps. Reactivating blood flow. Absolutely safe. This is the simplest exercise, yet extremely important for seniors over 60 who experience leg swelling, cold feet, or difficulties standing for long periods. Sit upright on a chair with both feet flat on the floor. Lift the toes up toward the shins while keeping the heels on the ground. Then press the toes down into the floor and lift the heels up. Move slowly and with control. Perform 20 to 30 repetitions 2 to 3 times per day. This exercise helps maintain continuous venous return, especially effective when you have to sit for long periods, travel for a long time, or feel too tired to stand. Support exercise 2. Supported single leg stance. Connecting circulation with balance. Good circulation is not enough if balance is poor. The risk of falls remains high. This exercise helps the brain, muscles, and blood vessels communicate again. Stand next to a table or chair, lightly touching it with one hand. Shift your weight onto one leg. Lift the other foot off the floor 1 to 2 centimeters, no need to lift high. Hold for 20 to 30 seconds, breathe normally, eyes looking straight ahead. Switch sides. Perform 2 rounds per side. What matters is not standing perfectly, but time under load. This sustained muscle contraction helps blood continue to move while also training reflexes for moments when you slip or trip. Smart combination. Heel raises with hold, the main exercise. Ankle pumps, maintain continuous blood flow. Single leg stance, protect balance. Total time less than 5 minutes. But the impact on circulation, balance, and confidence is very real. And from here, the most important thing is no longer how much you exercise, but that you begin to believe your body is still capable of recovery. As you can see, these movements are so simple that anyone can do them. So the next important thing is that you feel completely safe when you begin. If you are over 60 and concerned about heart health, blood pressure, diabetes, arthritis, disc herniation, or if you have ever experienced a fall, please hear this clearly. You do not need pain for it to be effective. The exercises you just saw all belong to the category of exercises for seniors. Low impact with no jerking, no jumping, and no forceful joint twisting. They are commonly used in post-surgical rehabilitation and in at-home senior health care. The safety principles are very simple. Always have a support point, chair, table, wall. Move slower than you think you need to, and stop if you feel dizzy, sharp pain, or shortness of breath. If you have had heart surgery, vascular surgery, or spinal surgery, start with half the repetitions during the first 2 to 3 days. Your body needs time to relearn how to pump blood properly. This is not a challenge. It is a gentle invitation for your body to return to its natural state of safety. And when fear is set aside, the next thing you will begin to feel is a new sense of confidence returning. And now, this is the most important moment. The moment you begin to see your body in a completely different way. After 60, the problem is not that you are getting weaker because of age. The truth is, your body is simply missing the right signals it needs. You do not need to take more steps. You do not need to force yourself to train harder. And you certainly do not need to endure pain to prove anything. What the senior health body needs right now is purposeful movement, enough time under tension, and the correct muscle groups that have been neglected. That is why properly designed exercises for seniors can be far more effective than simply trying to move enough. Not because you are doing more, but because you are doing it right. When you understand this, exercise no longer feels like an obligation. It becomes a tool for self-protection. And from that moment on, you are no longer exercising to fight aging. You are cooperating with your body to preserve your independence. When you begin to cooperate with your body, instead of fighting against it, a new belief quietly starts to form. After 60, hope does not come from big, dramatic changes. It comes from small shifts in the right direction. From the feeling of warmer feet in the evening, from standing up from a chair without hesitation, from the confidence of walking without the fear of losing balance. This is not a miracle. It is biology being reawakened in the right way. Many seniors once believed that decline was inevitable until they realized that the body has always been ready to respond as long as it receives the right signals. And this new belief is very simple. Every day, I can still do something to protect my independence. You do not need to be perfect, you just need to continue. Because strength at this stage of life is not about how far you can walk. It is about still being in control of every step you take. If just one small movement today can help protect your independence tomorrow, then this is the moment to turn that belief into action. Right now, don't rewind. Don't try to remember everything. Just choose one exercise that feels right for you and do it today. Not because I said so, but because your body needs that signal every single day. If you're ready to begin, leave just one word in the comments. Yes, it's a small commitment to yourself. And if you're wondering, am I stable enough or do I need to go further? The next video will appear right on your screen where I share a higher level balance test to help you know exactly where your body is right now and what it needs next. Watch the next video because this journey doesn't end here.